test. If the user makes an error, our application shows the user where the mistake was made, as well as suggesting the point they need to return to in order to complete the test. Now that the patient has completed a test, we can compare their performance to what is expected for their age group, education level, and gender. The application provides graphs for this data, which allows doctors to easily assess the results. SmartStrokes also allows patients to take a clock drawing test and the Ray-Ahlstrom test. Both of these involve recreating a certain image. Our application allows doctors to share the test with other doctors or replay it at a later time. Here is an example replay of a clock drawing test which was taken earlier. With all of the advantages that SmartStrokes provides, the application can have a lasting impact on the medical community and improve the lives of those affected by strokes.
So to give some background on some of the cognitive tests that we implemented in our project, we considered many. There are actually a lot of these tests. We discussed with Dr. Nancy Leslie, a neuropsychologist who works in the Health Sciences Center here at Texas A&M, suggested 3 tests to us that she would find useful in her work. The first is called the trail making test. So in this test, the goal is to trace a series of nodes in a particular order, in the version A being from 1 to 2 to 3 to 4 and so on, and in the version B from 1 to A and 2 to B until you reach the last letter. So the goal of this test, it provides the ability to test for the perception and planning of the patient. One important characteristic is that it can help show the presence of a hemispatial neglect, which is an inability to process stimuli on a certain side of the body. So patients who suffer a stroke may not be able to see nodes that are on the left, and so if they consistently take time finding nodes on the left, they may have a left hemispatial neglect. The second test we implemented is called the clock drawing test. In this test, the patient is asked to draw a clock face, given only a circle, and they must draw the numbers of the clock and set the time to 10 past 11. This can be difficult for some patients because although the time contains the word 10, it doesn't actually point to the number 10. It can also help show planning on the side of the patient if they anchor their positions of their numbers by